Phlebotomy exam prep for beginners. Question 1. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 2. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A. Health hazard. Option B. Flammability hazard. Option C. Instability or reactivity hazard. Option D. Specific or special hazard. The correct answer is option C. Instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 3. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A. Complete blood count, CBC. Option B. Blood cultures. Option C. Erythrocyte sedimentation rate, ESR. Option D. C-reactive protein, CRP. The correct answer is option B. Blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 4. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 5. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 6. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option of rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 7. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A. 70% isopropyl alcohol alone. Option B. chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 8. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 9. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A, blood culture, gold SST, lavender. Option B, gold SST, lavender, blood culture. Option C, lavender, blood culture, gold SST. Option D, blood culture, lavender, gold SST. The correct answer is option A, blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 10. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 11. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A, over-isotonic chilling. Option B, exposure to direct room light or sunlight. Option C, inverting the tube more than 10 times. Option D, delays in serum separation beyond 4 hours. The correct answer is option B, exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 12. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A, concentrated isopropyl alcohol. Option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C, warm water mixed with mineral oil. Option D, liquid hand soap solution. The correct answer is option B, a 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 13. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or four-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 14. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A. Prothrombin time, patient. Option B. Activated partial thromboplastin time, APTT. Option C. Bleeding time test. Option D. Fibrin degradation products, FDP. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 15. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A 9:1. Option B 4:1. Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to-additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 16. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B. Chill the tube in an ice slurry immediately after drawing. Option C. Protect the specimen from light by wrapping it in heavy foil. Option D. Centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 17. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 18. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A. Drawing blood from a patient who has explicitly refused the procedure. Option B. Making a minor clerical error on a specimen tube label. Option C. Forgetting to wash hands between routine patient encounters. Option D. Accidentally causing a small hematoma during an authorized draw. The correct answer is option A. Drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 19. What type of specimen is required for a plasma hemoglobin test? Option A. Serum separator tube, SSD. Option B. Plain red top tube. Option C. Heparinized or EDTA plasma free of hemolysis. Option D. Whole blood collected in a gray top tube. The correct answer is option C. Heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 20. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 21. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 22. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 23. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry, hematology, microbiology, and blood bank perform different categories of testing. Question 24. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 25. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, protective reverse isolation. The correct answer is option C, contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 26. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A, erythrocyte sedimentation rate, ESR. Option B, oral glucose tolerance test, OGTT. Option C, activated partial thromboplastin time, APTT. Option D, blood urea nitrogen, BUN. The correct answer is option B, oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 27. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 28. What is the correct order of draw for a capillary puncture when collecting multiple microcollection tubes? Option A, serum tubes, heparin tubes, EDTA tubes. Option B, EDTA tubes, other additive tubes, serum tubes. Option C, heparin tubes, EDTA tubes, serum tubes. Option D, serum tubes, EDTA tubes, heparin tubes. The correct answer is option B, EDTA tubes, other additive tubes, serum tubes. Capillary order of draw places EDTA specimens first, followed by other additive tubes and then serum tubes. This order helps prevent microclot formation in small volume hematology specimens. Venipuncture order cannot simply be applied to skin puncture collections. Question 29. What does the term phlebotomy literally mean in Greek? Option A, to clear a blood clot. Option B, to measure blood cells. Option C, to cut into a vein. Option D, to study circulating fluids. The correct answer is option C, to cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 30. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 31. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 32. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C. The palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 33. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act? HIPAA. Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 34. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B. A sharp, radiating, electric-like pain down the arm. Option C. A sudden feeling of warmth at the puncture site. Option D. Small red spots spreading around the arm. The correct answer is option B. A sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 35. Which of the following situations can lead to a charge of negligence against a phlebotomist? Option A. Forgetting to sign your initials on a laboratory requisition sheet. Option B. Leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Option C. Experiencing a minor specimen rejection due to an underfilled tube. Option D. Utilizing a butterfly needle on an elderly patient's hand vein. The correct answer is option B. Leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Negligence occurs when a healthcare worker fails to meet the expected standard of care and the patient is harmed. Leaving a tourniquet on for 5 minutes can cause avoidable injury and inaccurate results. A poor outcome alone is not negligence unless duty, breach, harm, and causation are present. Question 36. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B. An unconscious emergency room patient requiring urgent diagnostic lab work. Option C. A patient verbally states they agree to the blood test. Option D. A parent signs a waiver for their underage child. The correct answer is option B. An unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 37. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A. Chilled on a slurry of ice and water. Option B. Maintained at body temperature, 37 degrees Celsius. Option C. Protected entirely from light exposure. Option D. Frozen immediately in dry ice. The correct answer is option B. Maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 38. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A, potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, DDTA. The correct answer is option A, potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 39. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 40. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A, it decreases the pain perception of the infant. Option B, it increases localized arterial blood flow up to 7-fold. Option C, it sterilizes the deeper layers of the epidermis. Option D, it prevents the formation of an unneeded hematoma. The correct answer is option B, it increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 41. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 42. What color top tube is used to collect specimens for lead testing? Option A, tan or royal blue with EDTA. Option B, light blue. Option C, light green. Option D, yellow. The correct answer is option A, tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 43. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option A, 1:1. Option B, 5:1. Option C, 9:1. Option D, 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 44. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A, allowing a serum separator tube to clot completely before centrifugation. Option B, balancing the centrifuge correctly with tubes of equal volume. Option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D, keeping a plasma specimen chilled on an ice slurry. The correct answer is option C, centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 45. What is the correct site for performing a dermal puncture on an adult patient's finger? Option A. The exact center of the finger pad on the index finger. Option B. The fleshy, off-center side of the distal segment of the middle or ring finger. Option C. The side of the pinky finger close to the nail bed. Option D. The palmar crease of the thumb. The correct answer is option B. The fleshy, off-center side of the distal segment of the middle or ring finger. Adult finger puncture is performed on the fleshy, off-center side of the distal segment of the middle or ring finger. This location provides good capillary flow while avoiding bone and heavy nerve concentration. The center pad, thumb, index finger, pinky, and nail areas are less desirable. Question 46. What does the term lipemia describe? Option A. A high concentration of broken red blood cells giving serum a red tint. Option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C. A dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D. A clear, watery fluid component lacking any cellular proteins. The correct answer is option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 47. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A. Negative pressure isolation room, airborne precautions. Option B. Positive pressure isolation room, protective isolation. Option C. Standard contact isolation room. Option D. Droplet precaution room. The correct answer is option A. Negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 48. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 49. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A. Releasing the tourniquet within 1 minute of needle insertion. Option B. Keeping the patient's arm down during the venipuncture procedure. Option C. Allowing the patient to pump their fist repeatedly before and during the draw. Option D. Transporting the specimen to the laboratory within 30 minutes. The correct answer is option C. Allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 50. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 51. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 52. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 53. Which of the following is the most critical step in performing any phlebotomy procedure? Option A, choosing the correct size needle. Option B, verifying patient identification. Option C, selecting the appropriate vein. Option D, applying the tourniquet tightly. The correct answer is option B, verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 54. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 55. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 56. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C. Document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 57. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A, The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 58. Which of the following elements is a key component of quality control in a point-of-care testing? POCT program. Option A. Documenting the daily temperature of the laboratory refrigerator. Option B. Verifying that the patient's insurance information is updated. Option C. Running electronic or liquid controls according to manufacturer and facility guidelines. Option D. Cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C. Running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 59. Which gauge needle has the smallest lumen diameter? Option A. 18 gauge. Option B. 21 gauge. Option C. 23 gauge. Option D. 25 gauge. The correct answer is option D. 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 60. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A. To clear any residual skin surface contaminants from the needle. Option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Option C. To activate the coagulation cascade prior to sample collection. Option D. To check if the vein has adequate pressure to fill a full tube. The correct answer is option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 61. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D. Show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 62. How many times should a light blue top tube be inverted immediately after collection? Option F. 1 to 2 times. Option B. 3 to 4 times. Option C. 5 to 8 times. Option D. 10 to 12 times. The correct answer is option B. 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 63. Which of the following conditions can lead to a light mix specimen? Option A. The patient did not fast before a lipid panel draw. Option B. The specimen was hemolyzed during collection. Option C. The tube was left under direct light for too long. Option D. The patient was severely dehydrated. The correct answer is option A. The patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake, especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 64. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 65. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 66. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 67. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 68. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 69. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 70. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 71. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 72. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 73. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 74. What is the definition of fomite in an infection control context? Option A, an insect that transmits a virus. Option B, an inanimate object capable of harboring and transmitting infectious agents. Option C, a chemical agent used to sanitize skin surfaces. Option D, a specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 75. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A, CDC. Option B, FDA. Option C, OSHA. Option D, CLSI. The correct answer is option C, OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 76. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A, a 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 77. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 78. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A. Tying the tourniquet directly over the intended puncture site. Option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C. Having the patient pump their fist continuously during needle insertion. Option D. Inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 79. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A. A standard needle attached to the syringe puncturing the tube top directly. Option B. A syringe transfer device with a shrouded needle. Option C. Pouring the blood from the syringe barrel after removing the stopper. Option D. Injecting it through a butterfly needle set. The correct answer is option B. A syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 80. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 81. What type of mask is required when entering a room designated for droplet precautions? Option A. A certified N95 respirator mask. Option B. A standard fluid-resistant surgical mask. Option C. A cloth face covering or scarf. Option D. No mask is required if you stay 2 feet away from the bed. The correct answer is option B. A standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 82. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A. Powdered latex. Option B. Non-powdered latex. Option C. Nitrile or vinyl. Option D. Cotton utility gloves. The correct answer is option C. Nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 83. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Voiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 84. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A. Calibrating the machine once every year. Option B. Running control solutions at scheduled intervals according to facility protocol. Option C. Cleaning the display screen with water after every patient test. Option D. Trusting the automated self-check system without external verification. The correct answer is option B. Running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 85. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 86. If a patient is receiving an intravenous 4. Infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A. Directly from the foreline itself. Option B. From the left arm. Option C. Above the foresight on the right arm. Option D. From the hand on the right arm. The correct answer is option B. From the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore-infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 87. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A. Pull, aim, squeeze, sweep. Option B. Push, aim, slice, secure. Option C. Pull, activate, squeeze, shake. Option D. Press, aim, secure, sweep. The correct answer is option A. Pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 88. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A. Hematoma. Option B. Hemolysis. Option C. Petechiae. Option D. Ichthyosis. The correct answer is option C. Petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ecchymosis refers to broader bruising. Question 89. A specimen for a lactic acid test must be handled using which special accommodation? Option A, placed immediately on an ice slurry. Option B, incubated at 37 degrees Celsius until tested. Option C, kept away from all light sources using foil. Option D, centrifuged immediately within 5 minutes of draw. The correct answer is option A, placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 90. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 91. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A, plasma. Option B, serum. Option C, whole blood. Option D, buffy coat. The correct answer is option B, serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 92. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 93. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 94. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin time. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 95. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, Using a 21-gauge needle on a large vein. Option D. Drawing a serum separator tube before a green tube. The correct answer is option B. Underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 96. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A. Falsely high fats in the patient's diet. Option B. High concentrations of bilirubin in the serum or plasma sample. Option C. Excessive destruction of red cells inside the tube due to rough handling. Option D. Utilizing the wrong color top tube during collection. The correct answer is option B. High concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 97. What does the term basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 98. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A. 2 to 4 hours. Option B. 4 to 6 hours. Option C. 8 to 12 hours. Option D. 18 to 24 hours. The correct answer is option C. 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 99. Which of the following blood components is responsible for the initiation of the coagulation process? Option A. Erythrocytes. Option B. Leukocytes. Option C. Thrombocytes. Option D. Hemoglobin. The correct answer is option C. Thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 100. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A. Assault. Option B. Battery. Option C. Invasion of privacy or breach of confidentiality. Option D. Negligence. The correct answer is option C. Invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations.